Good morning, dear friends. As a continuation of our anatomy on the osteology, which is the bone after the cranial vault, we are going to talk about a very interesting subject and very important subject in the field of applied neuroanatomy, which is the anatomy of the skull base. As you all know, the brain rests on the skull base and the tentorium, and the skull base is formed of 5 bones and containing many foramina for the exit and entrance of the cranial nerves, the brainstem, the arteries, the veins, and it is the site of many approaches for difficult skull base lesions. So the bony skull, this is the view you see when you remove the brain and you look to the skull from above. This is a real skull. Looking from above, you see 3 fossae and many foramina. The bony skull, the skull base is formed of 5 bones. They fuse together forming the skull base, which are from anterior to posterior, the frontal bone, and with on either side of the ethmoid bone. Behind the ethmoid bone we have the sphenoid bone. Lateral to the sphenoid bone we have the temporal bone, and posteriorly we have the occipital bone. And as you know, the bony skull is commonly divided into fossae, anterior, middle, and posterior fossa. So with the different colors, the violet color is the orbital plate of the frontal bone, forming the base of the anterior fossa or the roof of the orbit. On either side of the ethmoid bone in the midline, and behind the ethmoid bone in green is the sphenoid bone, which is forming the medial part of the middle fossa and a posterior part of the anterior fossa. And lateral to it and posterior to it is the temporal bone, which is, we'll know all the details about this. Is the squamous temporal, this is the petrous temporal, and posteriorly is the occipital bone. So 5 bones: frontal, ethmoid, sphenoid, temporal, and occipital. These are the fossae. Anterior fossa is shallow, the middle fossa is deeper, and posterior fossa is the deepest. The frontal bone, the orbital plate of the frontal bone, as you saw, forms the floor of the anterior fossa or the roof of the orbit on either side of the ethmoid bone, articulating with the lesser wing of the sphenoid. So the floor of the anterior fossa laterally is formed by orbital plate of the frontal bone, and in the midline by the ethmoid bone. And the frontal bone consists of 6 parts: 1 squamous, 1 nasal, 2 orbital plates, and 2 zygomatic plates. The squamous part of the frontal bone, 1 bone, of course in children till the age of 8 years, is a metopic suture that is closed after that. And so 1 squamous part, 2 orbital plates, 2 zygomatic processes articulating with the zygomatic bone, and 1 nasal. So 1 squamous, 1 nasal, 2 orbital, and 2 zygomatic. Again, squamous part of the temporal of the frontal bone, below it the nasal part of the frontal bone, on either side the orbital plate of the frontal bone and the zygomatic process of the frontal bone. Another view: squamous, nasal, orbital, and zygomatic. And from above you see it, orbital plates and the ethmoid in between. Ethmoid bone is forming, as we said, the midline of the anterior cranial fossa, and it is formed of parts which are called the crista galli in the midline and the cribriform plate of the ethmoid on either side, which is the roof of the ethmoidal sinus. So this is the ethmoid bone having a horizontal plate and the vertical plate. Upper part of the vertical plate is the crista galli, and this is participating part of the nasal septum, and it carries here the superior and middle turbinates, which are parts of the ethmoid bone, and very laterally we carry the lateral wall of the ethmoid sinus, is the medial wall of the orbit, and it is called the lamina papyracea, very thin bone. Another view, crista galli, perpendicular plate, horizontal plate, the cribriform, many holes passing the filaments of the olfactory nerve, and we have the turbinates and the ethmoid air cells and the orbital or lateral plate, lamina papyracea. Another view, so this is the middle concha, this is the superior turbinate or superior concha, middle turbinate or middle concha, the ethmoid and the orbital plate. And also we have horizontal plate, cribriform plate, and a vertical plate, crista galli, and perpendicular plate. Behind the sphenoid bone, behind the ethmoid bone in the midline, and laterally we have the sphenoid bone, which forms a big part of the middle cranial fossa, and what is apparent in the middle fossa is the lesser wing articulating with the orbital plate of the frontal bone. So it is sphenoid bone forms the posterior part of the anterior fossa. And after the hypophyseal fossa in the midline, containing the pituitary gland in the roof of the sphenoid sinus, and lateral to the hypophyseal fossa there is the greater wing of the sphenoid, forming the medial part of the middle fossa and containing the important foramina. So the foramina of the middle fossa actually are present in the greater wing of the sphenoid. And in the midline posteriorly, we have the basi-sphenoid articulating with the basi-occiput of the occipital bone, forming the clivus. So this is a diagram of the sphenoid bone. In the midline, we have the hypophyseal fossa, and we have the basi-sphenoid, and laterally we have the lesser wing of the sphenoid and the greater wing of the sphenoid, and of course inferiorly, not apparent in the middle fossa, are the pterygoid plates, the medial and lateral pterygoid plates. This is a coronal view showing the sphenoid bone and the sphenoid sinus, which is the air inside the sphenoid bone and sphenoid septum, and the roof is present, the hypophyseal fossa, and on either side of the sphenoid you can find the cavernous carotid artery and the cavernous sinus. Another view of the sphenoid bone, body, lesser wing with the optic foramen, greater wing with the different foramina. You will see the rotundum, oval, and spinosum, and the pterygoid plates, medial and lateral. This is the roof of the sphenoid sinus, the roof of the sphenoid bone, forming the middle fossa. In the midline, we have here the plana sphenoidal, the sulcus chiasmaticus, the tuberculum celli, the hypophyseal fossa, the dorsum celli, and the basi-sphenoid. So the most medial part of the, we have laterally the lesser wing of the sphenoid and the greater wing of the sphenoid. The medial part of the greater wing, of the lesser wing of the sphenoid, is the anterior clinoid, and through it is the optic foramen. So medial to it is the optic foramen, optic nerve. So this is the anterior clinoid process. The most lateral part of the tuberculum sellae is the middle clinoid process, and the lateral part of the dorsum sellae is the posterior clinoid process. So we have three clinoids: anterior, middle, and posterior clinoids. Also, you can notice here that the foramina of the middle fossa, foramen rotundum in the medial wall, foramen ovale in the floor, and foramen spinosum behind and lateral to it in the floor are present in the greater wing of the sphenoid. Another: planum, pituitary fossa, dorsum sellae, basis sphenoid, lesser wing, greater wing, anterior clinoid, the middle clinoid, and the posterior clinoid processes. The temporal bone, as we are saying, is having a squamous part, petrous part, mastoid part, and tympanic part. The squamous part forming the lateral part of the middle fossa. We saw that the greater wing is the medial part containing the foramina. Lateral to it is the squamous part of the temporal bone, and it contains zygomatic process articulating with the zygomatic bone. Also, part of the temporal bone is the petrous bone, which is containing the middle and inner ear, and the petrous bone separates the middle fossa from the posterior fossa, and it also contains, beside the inner and middle ear, the carotid canal, the jugular foramen, and the internal auditory meatus passing the acousticofacial bundle. Third bone is the mastoid, just behind the ear and containing many air cells, as you know, mastoid antrum and air cells. And a small bone, which is the tympanic bone, is below the zygomatic process of the temporal bone, forming the external auditory canal apart from the roof formed by the squamous temporal bone. So, temporal bone, squamous, lateral to the sphenoid greater wing, petrous, containing the structure separating the middle from posterior fossa, mastoid, behind the ear, tympanic, the lateral and floor of the external auditory canal. Here we can see the middle fossa is formed by the greater wing of the sphenoid with the foramina and the squamous temporal bone lateral to it. And here we can see also the petrous bone separating the middle from the posterior fossa is a part of the temporal bone, and the internal auditory canal and jugular foramen are present in the temporal bone. Another view, you see the middle fossa, you see the foramen ovale and the foramen spinosum. The foramen rotundum is not apparent because it is present in the medial wall. From outside, you can see the zygomatic process of the temporal bone articulating, of the squamous part of the temporal bone, articulating with the zygomatic bone, and you see the tympanic portion forming the floor and the anterior and posterior wall of the external auditory canal. Another view of the temporal bone. So this is the squamous temporal bone. From inside, this is the petrous temporal bone. Here is the mastoid temporal bone, and here is the tympanic temporal bone. Occipital bone, posterior fossa, protecting the cerebellum and occipital cerebrum, giving attachment, insertion to many muscles and ligaments. Occipital bone consists of three parts: the squamous part forming the lateral and posterior part, the condylar part, which is the occipital condyle. You all know about it, kidney-shaped, articulating with superior articular surface of the atlas, forming a very, very strong atlanto-occipital joint and containing the hypoglossal canal. From the strength of the atlanto-occipital joint, you find that the when there is a craniovertebral anomaly, the occiput or the skull and the atlas behave as one unit, because this is a very strong ligament. And the third part of the occipital bone is the basal part anteriorly, which is basi-occiput articulating with the basi-sphenoid forming the clivus. So this is the sagittal, lambdoid sutures. All this is the squamous occipital bone covering part of the occipital lobe and the cerebellum and containing corrugations on the surface. The most important, something we call the external occipital protuberance. It denotes the confluence of sinuses, the junction between the superior sagittal sinus, the straight sinus, and transverse sinuses. And on either side of it is the superior nuchal line. There are lesser important prominences, which is the supreme nuchal line and the inferior nuchal line, and what we call the external occipital crest, and this is the posterior border of the foramen magnum. All this is the squamous occipital. So we have also the condylar, and you see here a canal in the occipital condyle transmitting the hypoglossal nerve above the occipital condyle and medial. And anteriorly, you find the anterior edge of the foramen magnum, basi-occiput, articulating with the basi-sphenoid, forming the clivus. Looking from below, the squamous part of the occipital bone, condylar part of the occipital bone, the basal part of the occipital bone. From inside, this is the squamous part of the occipital bone. On either side anteriorly, lateral to the foramen magnum is the condylar part, and this is the basal part. Again, squamous, condylar, basal. This is the junction between the basi-occiput with the basi-sphenoid forming the clivus. Upper part of the clivus from the sphenoid bone, lower part is from the occipital bone. Internal structures and foramina. You will see in this diagram too many details, but it's not that difficult. If you divide the base into anterior, middle, and posterior fossae, you can easily grab them. It's not difficult. Another view, many details. We'll start by the anterior fossa. Each fossa has foramina and structures. So in the anterior fossa, we have something called the foramen cecum, transmitting emissory veins from the nose to the skull. And we have the crista galli, as we said, which is a part of the roof of the ethmoid bone. And on either side of the crista galli, we have the cribriform plate of the ethmoid, forming the roof of the ethmoid sinus, transmitting filaments from the olfactory nerve, from the olfactory mucosa, down to the olfactory bulb and olfactory tract, if you remember. Also, one of the contents of the anterior fossa, the optic foramen, it is containing the optic nerve, containing the ophthalmic artery below the optic nerve, and a falciform ligament of dural fold, which is the cause of optic nerve injury in head trauma. The falciform ligament hits the optic nerve inside the canal and can cause blindness after trauma. Also, you can consider one of the contents of the anterior fossa or the middle fossa, the superior orbital fissure, which transmits very important nerves we'll see now. If you remember, the live free to see no insult at all, and the veins. So here is the anterior fossa, and here is the midline anterior foramen cecum, emissory vein from the nose to the brain. And then behind the foramen cecum is the crista galli. On either side of the crista galli, cribriform plate of the ethmoid, lateral to it the orbital plate of the frontal bone, and articulating with the lesser wing of the sphenoid, and lesser wing of the sphenoid contains the optic foramen. So this is the anatomy: anterior fossa, ethmoid in the middle, orbital plates of the frontal bone laterally, and the body of the sphenoid, the planum sphenoidal, called the jugum sphenoidal, and then laterally here the lesser wing, and anterior crinoid and medial to it optic foramen. Another view of the anterior fossa, and you see that orbital plate, lesser wing of the sphenoid, ethmoid, cribriform plate, foramen cecum, crista galli. Superior orbital fissure, to see it well, you have to see it from the front, and here you will find that this fissure is a space present between the lesser wing and the greater wing of the sphenoid. Another view, this is from the right side, this is the nose, and this is the medial wall of the orbit. Lateral wall of the orbit is formed by the greater wing of the sphenoid. Roof of the orbit posteriorly is formed by the lesser wing of the sphenoid. Lesser wing of the sphenoid contains the optic foramen. Between the lesser wing of the sphenoid and the greater wing of the sphenoid we have superior orbital fissure. Also between the greater wing of the sphenoid and the maxilla we have the inferior orbital fissure. These are the contents of the superior orbital fissure, and as we said before, it contains the lacrimal, frontal, trochlear, and superior division of oculomotor, nasociliary, abducent, inferior division of the oculomotor. It is intersected by a tendinous ring called the annulus of Zinn, which is containing part of the superior orbital fissure called oculomotor part, and because it is carrying the superior and inferior branches of oculomotor, and the optic canal, optic foramen, optic nerve, which is surrounded by the annulus of Zinn, attached to it medially and superiorly, containing the optic nerve and the ophthalmic artery. So, live free to see no at all insults. Of course, it carries also the superior branch of the ophthalmic vein. Inferior branch is in the inferior orbital fissure. The optic foramen is a foramen through which the optic nerve passes from the eye, posteriorly from the retina to the optic chiasm, in a canal called the optic canal, 11 millimeters in length. This is sagittal view showing that the optic nerve is covered by dura inside the orbit. Then we talk about the foramina and contents of the middle fossa, the inferior orbital fissure, which is carrying V2 and inferior ophthalmic vein, and the foramen rotundum carrying V2, foramen ovale carrying V3 with an artery, accessory meningeal artery, with a nerve, lesser superficial petrosal nerve, and with an emissary vein from the skull to outside. Behind it, foramen spinosum, through which passes the middle meningeal artery, and the foramen lacerum, which is triangular hole between the sphenoid bone, petrous apex, and the basi occiput, and it is closed by cartilage, doesn't carry any structure, with the internal carotid artery above it. So the lateral segment of the carotid doesn't pass through the foramen lacerum, but above it, to hug the clivus, forming the paraclival segment, if you remember. And about the inferior orbital fissure, as we said, it is present between the greater wing of the sphenoid and the maxilla, and it doesn't carry important things. So this is superior orbital fissure. Inferior orbital fissure can pass through it. It's not actually through it from foramen rotundum. It reaches through the infraorbital canal, forming the infraorbital nerve and passing through the infraorbital foramen. You can consider it passing, a small part passing in it, but the most important content, inferior orbital fissure, is the inferior division of the ophthalmic vein, and there is a small nerve, zygomatic nerve, which is not that important. Another view, and the foramen rotundum. Foramen rotundum, as we said, the foramina of the middle fossa are present in the greater wing of the sphenoid. In the medial wall of the middle fossa, there is a hole or foramen called foramen rotundum, through which passes V2, and in the floor of the middle fossa posteriorly is foramen oval in shape, and passes V3, and here is passing foramen spinosum for the middle meningeal artery, very famous middle meningeal artery. Here you will find also the foramen lacerum between the petrous bone, between the sphenoid bone and the sphenoid bone, the petrous bone, and the basisphenoid. This is the foramen lacerum, closed by cartilage. You will see more. Rotundum, oval, spinosum, foramen lacerum. This is again right side from above, optic nerve, optic chiasm, optic canal, and the Gasserian ganglion, the trigeminal root, and this is the V1 passing in the cavernous sinus into the orbit, the frontal division. This is maxillary division V2, and it's not apparent here, the mandibular division passing through foramen oval. So the rotundum pass through it, maxillary division of the trigeminal nerve V2. Another view, foramen rotundum, medial wall of the middle fossa. Foramen oval, you can see it when you do a CT, skull base, oval in shape. Posterior and lateral to it is the foramen spinosum. Foramen oval, you can say the contents are the otic ganglion. It's not inside the foramen, but it is below, immediately below the foramen. Otic ganglion, it's receiving from the lesser superficial petrosal nerve, parasympathetic, and supplying the parotid. It is lesser superficial petrosal from the tympanic plexus, from the glossopharyngeal nerve. So passes through the foramen oval. And the lesser superficial petrosal nerve, which is going to relay in the otic ganglion, passes through the foramen oval. And the V3, of course, you pass it through the foramen oval and emissary veins. So you can say structures passing through the foramen oval are oval. But actually the otic ganglion is not through the foramen, just as the greater superficial petrosal passes from the foramen. Or you can say the mandibular division with an artery, accessory meningeal, with a nerve, lesser superficial petrosal, with emissary vein. These are the structures passing through the foramen oval. Here, mandibular division, lesser superficial petrosal nerve, accessory meningeal artery, and emissary vein. Foramen spinosum is a small foramen transmitting the middle meningeal artery, and it is behind and lateral to the foramen oval. It's very important. In the old days, they used to say to stop bleeding from the middle meningeal extradural hematoma, you can push a matchstick in the foramen spinosum to compress the artery. And the foramen lacerum is here, foramen spinosum. Again, content of the foramen spinosum, mainly, most importantly, middle meningeal artery. Small middle meningeal branch of the mandibular nerve supplying the mandibular dura. It's not that important. So, again, oval, V3, lesser superficial petrosal nerve, accessory meningeal, emissary vein, spinosum, middle meningeal artery, meningeal branch of the mandibular. Foramen lacerum, as we said, is here and here, the petrous apex. It is medial to the foramen ovale. It is at the petrous apex. It is present between the petrous bone, between the sphenoid bone, and between the clivus. Petrous bone, sphenoid bone, clivus, covered by cartilage. And here is the lateral segment of the internal carotid artery above the lacerum, hugging the clivus on their way to the cavernous sinus. Contents of the posterior fossa, we have the very famous internal auditory canal carrying the facial and vestibulocochlear nerves. We have the very famous jugular foramen divided into anterior part containing the lower cranial nerves 9, 10, and 11, and so it's called the pars nervosa, and the posterior part containing the end of the sigmoid, the upper part of the jugular, having the jugular bulb called the pars venosa. Nervosa because carrying nerves, venosa carrying veins. And the most important foramen magnum, carrying the lower medulla and upper cord, carrying two vertebral arteries, carrying one anterior spinal artery by two branches from the vertebral and two posterior spinal arteries. And I forgot to add it here, it is carrying also the spinal part of the accessory nerve. You know, it arises from the motor nuclei of the upper cervical segments, C3, 4, 5, and it passes inside the skull through the foramen magnum, goes out through the jugular foramen. And also one of the important foramina is the hypoglossal canal at the anterolateral aspect, anteromedial aspect of the foramen magnum and the occipital condyle. So the internal auditory canal, we talked about it with the 7th and 8th cranial nerves, and it is formed of 4 compartments, 2 posterior and 2 anterior, and they are divided divided into upper and lower parts by the transverse crest or horizontal crest. And we have anteriorly the facial nerve 7 up and the cochlear nerve below, Coca-Cola. So here 7 up, here Coca-Cola, here the superior vestibular, here the inferior vestibular, and the superior vestibular nerve is separated from the facial nerve by a bar, by a crest called Bill's bar. Bill's bar, you know, the nickname for William House, the founder of the House Institute. And this is called Bill's bar, the bar of Bill, the bar of William House. And then you find here the cranial nerves passing inside the internal auditory canal, and anteriorly you will find the facial nerve with the nervus intermedius and the cochlear nerve. And posteriorly you find the superior vestibular and inferior vestibular nerves. So these are the posterior nerves, these are the anterior nerves. Jugular foramen is a very important foramen. You don't see it if you look from above. You have to look from superior, posterior superior. You can find it. It is present between the petrous and the occipital bone. Here is the view of the jugular foramen, and you can see that there are two compartments in the foramen, the pars nervosa anteriorly and the pars venosa posteriorly, and it is present below the internal auditory canal. And these are the structures. So this is anterior, the lower cranial nerves passing from the brainstem, if you remember, the post-olivary sulcus, and getting out from the jugular foramen in the anterior part of it, and the sigmoid and upper jugular and the jugular bulb occupying the posterior part of the jugular foramen. And of course, always the carotid canal is in front of the jugular vein, here in the petrous bone, here in the junction of the petrous bone and the occipital bone. Pars nervosa, pars venosa. And here the jugular, if you look from above, after removing, you know all that the cranial nerves are named 1, 2, 3, 4, 5, according to their point of entrance in the dura from anterior to posterior. So this is 9, 10, and 11. 12 is below at a lower level and more posterior, and this is in the pars nervosa. Here is the sigmoid forming the jugular vein posteriorly. End of the sigmoid sinus, start of the jugular vein, jugular bulb. Foramen magnum is a very important foramen, big foramen inside the base of the skull, and as we said, it carries important structures, and it is bounded by the basi-occiput and by the squamous occipital bone. So pars basalis, laterally the pars lateralis or the condylar part, and posteriorly by the squamous part of the occipital bone. And as we said, the contents of the foramen magnum are the lower part of the medulla, upper part of the cord, and are the two vertebral arteries which pass anteriorly, unite, forming the basilar artery. So, and we have the posterior cerebral, two posterior cerebral arteries from the vertebral artery, and one anterior spinal artery from two branches also from the vertebra. And here you find the spinal accessory from the upper cervical through the foramen magnum, entering the skull and getting out from the jugular foramen together with the cranial accessory. Hypoglossal canal is present in the condylar part of the occipital bone, and carries the hypoglossal or the 12th cranial nerve, lower and more posterior than the lower cranial nerves. 12. Skull base structures from anterior to posterior, you will find it on the skull. You shouldn't remember it like that, but I'm showing it from anterior to posterior. Let's go. Foramen cecum, crista galli, cribriform plate of the ethmoid, planum sphenoidal, sulcus chiasmaticus, tuberculum sellae with the middle clinoid, floor of the sella, dorsum sellae with the posterior clinoid, and then the clivus, basi-sphenoid and basi-occiput. And then we have the internal occipital protuberance, internal occipital ridge, and the grooves for the transverse sinuses. Again, you can say it here, 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 and here, and here, and here, and here. And the lateral structures from anterior to posterior, as we said, the midline structures, also you don't have to study it. Lateral structures, very important structures some people, they don't understand where it is. It's arcuate eminence. Arcuate eminence is a prominence in the anterior wall of the petrous bone, in the lateral part of the anterior wall of the petrous bone, denoting the site of the superior semicircular canal. If you remember, the superior, the lateral and posterior semicircular canals for the balance, this is the superior semicircular canal arcuate eminence, and here is the groove for the greater superficial petrosal nerve. These are two important structures. So if you put a line along the greater superficial petrosal nerve and another line through the arcuate eminence, you will get an angle of 120 degrees. The middle of this angle will show you here and here, will show you the site of the internal deuteric canal. So either an angle of 60 degrees between the greater superficial and the petrous internal deuteric canal, or between the greater superficial and arcuate eminence, and is the middle of this angle is, if you angle like that and the other one passing like that, and you get the middle, this is the internal deuteric canal. This is the arcuate eminence in the middle fossa. Of course, you know about lateral structures here, the lesser wing, the greater wing of the sphenoid, and the foramina, and here the lesser wing with the anterior clinoid, here the greater wing of the sphenoid with the foramina rotundum ovale spinosum, foramen lacerum, petrous bone, internal deuteric canal, and here is the groove for the greater superficial petrosal nerve. This is a nerve branch of the facial nerve reaching the geniculate ganglion, and it is passing through a separate foramen, pterygoid canal, not through the foramen ovale. Foramen ovale carries the lesser superficial petrosal. This passes through the pterygoid canal, parasympathetic relaying in the sphenopalatine ganglion and supplying the lacrimal gland. So during skull base approaches, you will see later, if you cut the greater superficial petrosal nerve, you get diminution of lacrimation, but not absence, because we have accessory lacrimal gland keeping the eye moist. Branch of the fascia relaying in the sphenopalatine ganglion, supplying the lacrimal gland. Another view, the greater superficial petrosal nerve. So look, the lesser superficial petrosal nerve passing through the foramen ovale, but the greater superficial petrosal nerve has nothing to do with the foramen ovale. It passes in the pterygoid canal to the pterygopalatine fossa. Here is the geniculate ganglion, geniculate ganglion. Here is the superior semicircular canal, arcuate eminence. And here is a view, the lateral contents, the transverse sinus, the inferior petrosal sinus from the cavernous to the jugular foramen, and the transverse sinus laterally, and the skull base from below. If you look to the skull from below, you should know the most important relevant things for us. This is the picture you have. You can identify some structures. Of course, you know these are the pterygoid plates. Of course, you know this is the palatine bone. Of course, you know this is the zygomatic bone, and this is zygomatic process of the temporal bone, and this is the sphenoid bone, and this is the foramen ovale, foramen spinosum, and this is the carotid canal, and here is the foramen lacerum, and here is the temporomandibular joint, here is occipital condyles and the foramen magnum, and the clivus, basisphenoid with basiocciput. And you find here the external occipital protuberance, superior nuclear line, so you can know some lines from below, as you see here, pterygoid, medial, lateral pterygoid plates, the greater wing of the sphenoid, the foramen lacerum, foramen magnum, the occipital condyles. If you go through more details, you can call this is the incisive fossa, and this is the palatine suture, this is the palatine bone, this is the medial pterygoid plate with lateral pterygoid plate, and the clivus, and the carotid canal here, the jugular fossa and jugular foramen behind it here, and the foramen lacerum here. Of course, this is the external occipital protuberance, very important, and the superior nuchal line. This is the inferior nuchal line. Again, from below, medial pterygoid, pterygoid hamulus. It is, if you see here, the medial pterygoid is forming the lateral boundary of the choana. What is the choana? The posterior nasal opening between the palatine bone, the nasal septum, and the medial pterygoid plate. And the medial pterygoid plate, lateral pterygoid plate unite together, forming a place where a nerve can pass, which is the Vidian nerve. Here is the palatine process, the incisive foramen. These are the upper teeth. This is the zygomatic bone, zygomatic arch, the sphenoid bone, middle fossa, foramen ovale, foramen spinosum, carotid canal in front of the jugular fossa with pars nervosa and pars venosa, occipital condyles, foramen magnum, external occipital protuberance, superior nuchal line, and here the inferior nuchal line, and we call the external occipital crest. So don't panic. If you see the base from below, you already know too much about the base so that you can identify the structures. And this is to show you that this is from the palatine bone. This is the sphenoid, this is the vomer, this is the sphenoid bone. Of course, lateral to the sphenoid is the squamous temporal and the petrous bone, and here is the occipital bone. As you know, it is going to be repeated. And this is the vomer. This is what we take from transsphenoidal to reach the sphenoid face, the sphenoid face, to go inside the sphenoid sinus, the keel of the boat, the vomer. You take it out to reach inside the sphenoid sinus and cell. Thank you very much for your attention, and remind you that the continuation of the skull base will be the skull base triangles and the skull base approaches. It's a continuation of this series, but not to make it that long, I decided to divide it into two parts. So here is the pure anatomy, and then after that we are going to talk about triangles and approaches. Thank you very much for your attention, and I hope to see you very soon.